So let's first talk about Schatzki's ring. So Schatzki ring was first described by Dr. Richard Schatzki, who was a German-American radiologist who described a ring-like structure in patients presenting with dysphagia in articles from 1953 to 1963 with his colleague John E. Gary. Here is a picture of Dr. Schatzki. Schatzki ring is totally benign. It is always associated with hiatal hernia. It is caused by reflux of acid and spasm of esophagus causing symmetrical mucosal tenting to reduce the diameter of esophagus. And it has been postulated that this may be a natural way for the body to prevent development of Barrett's esophagus. Okay, so let me show you a picture of Schatzki's ring, and as you can see, this is a barium esophagram, and you can see very clearly that right here is the Schatzki's ring. And if I show you an endoscopic picture, you can see on endoscopy that this is the Schatzki's ring. Now, what are the risk factors? So one of the risk factor is prolonged nasogastric tube. If you have a prolonged nasogastric tube, the lower esophageal sphincter will continue to remain open, which will make it very easy for acid reflux, and that can lead to the development of Schatzki's ring. Like I said, Schatzki's ring usually occurs in younger patients. It usually happens with meat and bread, and therefore sometimes it's called steakhouse syndrome, and it can lead to regurgitation of the food material to obtain relief. Symptoms usually occur when the diameter of the esophagus gets to less than 13 millimeters, and the treatment is dilation to break the ring followed by PPI to neutralize the acid, and it also reduces the recurrence of this lesion. Treatment duration on average may be up to 10 months, then these may recur and require repeat dilation. That's a very important point that I want you to remember for step 2 CK. They can give you a patient and they can tell you that about 10 to 12 months ago, the patient had a Schatzki's ring which was dilated, and now the patient is presenting with similar symptoms 1 year later. And you may make the mistake of thinking to yourself that the Schatzki ring was taken care of, so now there is a different pathology that's causing this abnormality. So don't fall into that trap. Schatzki's ring can be recurrent, and therefore if the patient is presenting with similar symptoms a year later, it's quite possible that he or she has another Schatzki's ring.